Good morning and welcome to the first International Scientific Webinar organized by the Persatuan Pegawai Sains Malaysia, PPSM, also known as Malaysia Association of Scientific Officers. Before we begin today's webinar, please allow me to introduce PPSM. PPSM was established on 27 October 2021 with its initial member of 241, consisting of various branches of science officers including microbiology, biochemistry, physics, biomedical, embryology, forensic, entomology, quality, instrumentation, aerospace, water, and many more. The membership increased rapidly over the past year. PPSM committee consists of 15 excos representing various ministries and organizations in Malaysia. The first president of PPSM is Technologist Nik Muhammad Nik Hazmi, Physics Science Officer from Hospital Kuala Lumpur. Our motto is leading transformation in conserving science. Our vision is to elevate the professional and technical expertise of science officers to help the government advance Malaysia as a developing country. Our mission is to conduct educational programs and activities to enhance the knowledge and expertise of all science officers in various governmental organizations in Malaysia. With that in mind, we have organized the first international scientific webinar to benefit all science officers nationwide. We aim to reach out to all science officers from various ministries and sectors and ultimately unite all science officers under one roof. We aim to establish connection and interaction among science officers, to unite all as one voice, to ensure our voice is heard at all levels. Together, we shall stand and grow stronger. Now, let me introduce our speaker for today's session, Mrs. Faizatul Lela Jafar. Mrs. Faizatul is the Biosafety and Science Officer, Occupational Safety, Health and Environment, Faculty of Medicine, University Malaya. Mrs. Faizatul is recognized as the subject matter expert in biosafety and biosecurity. She graduated with a bachelor's degree in applied chemistry at the University of Mara in 2004. She started a career at the University of Malaya in 2006 and gained various experience in biosafety and biosecurity since 2007. She has been appointed as the Biosafety Officer at the university since 2013 and was involved in establishing the University Institutional Biosafety and Biosecurity Committee, also known as IBCC. She is also actively involved as the resource person and trainer for professional certification program in Malaysia. Recently, she has been appointed as the co-opted technical committee member related to clinical laboratory testing and in vitro diagnostic test systems by Department Standards Malaysia. Without further ado, let us welcome Mrs. Faizatul to give a talk on sharing experience in Malaysia, implementing biosafety program management in SARS-CoV-2 diagnostic laboratory. Over to you, Mrs. Faizatul.
Thank you so much, Miss Angeli. Can you hear my voice?
Yes, clear.
Is it good?
Yes, it's good.
Yeah, okay. Thank you so much. First of all, I would like to thank our MC today for the introduction. Okay, and then first of all, I would like to thank PPSM, Persatuan Pegawai Sains. Basically, I just involved with all of you recently for inviting me as the first speaker of this webinar series for the association itself. I'm honored because I'm the first person who are going to be presenting in this webinar series. Okay, so I think without further ado, I would like to continue the presentation for today, because basically I'm going to give some overview and sharing experience in terms of how we handle and manage our biosafety during the pandemic SARS-CoV-2. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Thank you for your attendance today, for supporting this webinar series. Being part of the science officer, I'm honored to be part of you. I'm very grateful to meet all of you, and congratulations to all the officers, to all the ESCOM members who have been working very hard to establish all this. Okay, so for today, I would like to share my experience basically in implementing biosafety program for SARS-CoV-2 diagnostic lab during the pandemic COVID-19. Okay, sorry. Okay, so as we know, for Malaysian, our country preparedness is they have done a lot of things, I would say, in terms of references and how they prepared for all the diagnostic testing, for everyone involved in handling not only the healthcare workers as well as all the lab personnel, and all the promotion to inform all our community how to manage and to actually to reduce the numbers of infection during the pandemic COVID-19. I would say, and I'm very proud to be Malaysian, because basically Malaysia is one of the countries, and also Asian is also the world part that capable to manage pandemic COVID-19 during the infection period, the high infection period. So basically, I would say Malaysia has done a lot, and a lot has been established, especially all the procedures, all the training, all the documentation to guide us how to prevent exposure or infection for COVID-19. So basically, in terms of diagnostic lab testing, they have improved, starting from only the Ministry of Health who have been involved initially, but they expand towards all other labs, especially they also involve all the research lab to cater the needs of the increased numbers of samples for testing. So during that time, basically, I'm not part of the hospital diagnostic testing setting, sorry, but during I was involved in the H1N1 pandemic previously, 29. So I have some experience in terms of handling all the testing for during the pandemic. So I volunteer myself to being part of the for the testing, for involved in the lab, managing, handling all this during the pandemic SARS-CoV-2. So fortunately, I'm impressed that I managed to be part of the lab diagnostic testing during the pandemic. So basically, for the lab itself, they have started the preparation since the pandemic, the first confirm and announcement of the COVID identification. Like SARS-CoV-2 identification, they have been prepared as usual. Malaysia have been prepared for everything. And for our lab diagnostic testing, we have started our preparation since 2019. So basically, the staff has been trained on the procedure. They have come up with all the procedure in place, and then all the resources. They have conducted all the staff training, and to prepare for any samples in during that time. So basically, our first received sample was in February 2020. Okay, that is the first time we have received, and first, not saying that that is the first received sample. Basically, that is the first confirmation positive samples. So starting from there, we have started to receive a lot, I would say. So, and then we knew Malaysia had been locked down start from 18 March 2020. So during that time, everyone working from home, working at home. So basically, I'm part of the of everyone during that time. So end of March, someone contacted me asking me if I capable to be part of the diagnostic testing to support the labs. So basically, that is I would say that is the opportunity for me being part of this experience. So I started my journey in this experience end of March, and then starting from there, actually we received not much sample. Actually, it's only like 100 plus per day. So, but then during that time, we start to, learn and plan how to manage the testing properly, and basically how, all the procedure to really put in place, especially how to, you need to, what is the procedure to release the results and so on. And then during that time, the samples keep increasing. We know that since April, everything start increasing. Okay, the number infection rates keep increasing. So basically, if we are saying that Malaysia has like 100 positive cases, basically in our lab we have like thousands samples, right? So because of all these surveillance. So during that time, we start to increase our numbers of samples, and then we start to during that time, everything start to lacking. I mean, in terms of the reagent itself, Malaysia have been so shortage of PPE, of reagent to conduct the testing. So during that time, it's not only Malaysia, I would say the worldwide, everything is shortage, but then we can't get anything from outside as well. We are not a country that produce all the PPE basically, and the reagent is not much. That is only like 4 or 5 months after the pandemic. So basically there is no specific testing for SARS-CoV-2. So the test that we had previous, that we liaise with is actually from the WHO. So we use the WHO and we use the same reagent. So worldwide is using the same thing. So basically, the company cannot produce a lot. So basically, one positive case equal to 50 samples received for the lab. So and then we start receive equipment. So based on the numbers of samples, we know that we need to increase our testing rate, and then we start to receive like 300 samples per day. And then what happened was we have only, the number of staff involved is not that many. So during that time, like middle of April, we start to plan to increase. We start to expand our facility labs, because basically we start with only like 2 labs involved in doing the testing, but we need to increase because of the number of samples. And then I would say starting May, actually we have done we have reached to 700 samples per day. However, during that time, the expansion of other testing lab has been start. So numbers of staff need to be segregated between the labs. So I'm sorry. So how do we implement the implementation of the biosafety program during the transition of the increasing numbers of lab, increasing number of samples, and we need to involve staff which has not initially been trained. So what is the challenges and how we manage it? So basically, we start with biological risk assessment. So in any activities, as we know, any changes, we need to conduct the risk assessment. So basically, the initial risk assessment need to be improved, because there were changes of personnel, procedures, the numbers of labs involved, etc. And then after the risk assessment has been conducted, we need to communicate with all the personnel involved. What is the updated mitigation, what you need to do, what need to be improved, and so on. And after that, we need to review and evaluate whether or not the mitigation, the proposed mitigation or implemented mitigation has been, is working, is good, and if there is any improvement. So basically, that has been done, and what need to be recorded is the risk assessment need to be documented and recorded. So basically during that time, the expansions of number of labs from 2 to 5, and you can see that based on the numbers of facility involved, we need to increase the numbers of labs. So within periods of 1 to 2 weeks, we need to increase the number of staff. We need to plan all the facility and the equipment involved, and we need to conduct the risk assessment. We need to come up with the flow process and procedure involved, because changes of facility absolutely was involved, because initially they are like one facility involved 1 or 2 procedure. However, when we expand, we have identified, I mean, every single lab have their own different activities. So what happened in terms of facility and equipment? What we need to do was restructuring and redesign the facility and equipment. So basically, we need to move the equipment. We need to identify which lab involved in which activities, and what is the hazard, what is the what need to be improved and mitigate during that time. So, and then another thing is that when we also encounter challenges whereby we have equipment and calibration need to be done. Okay, so we need to involve outsider to be in our facility, and we need to arrange for the appointment for the equipment, the equipment not to be used during that time, because there is a calibration need to be done. However, we need to achieve our testing. I mean, our tests per day. We need to and also we also encounter technical issue, because as usual, when we put in a lot of equipment, basically we have like electrical problem, we have space problem, we have all the technical arrangement in terms of the facility itself. That is, I mean, like, it's very challenging, because we need to move, we need to change, we need to restructure within a week and 2. So what we did was we start with planning and scheduling everything. We need to schedule all the calibration. We need to schedule when we can move, because we don't want to jeopardize our testing. The needs of the results to be out every day. So involvement of the administrative and purchasing team. So purchasing team, I would say, is a very important person during that time, because we don't want to get any like I mean lacking of if they did not purchase the item, so we don't have all the reagent, we don't have all the apparatus, we don't have all the PPE in place. So every single time we need to plan in terms of purchasing, in terms of our inventory, especially reagent. I would say during that time to get a reagent is very, very hard. Okay, and then minor changes of the flow process, because basically start from 2, we need to distribute the identify the activities based on the labs, and then we need to plan the flow process, so that we understood that the biosafety a component was not jeopardized because of the changes. Okay, and then time management as well is very critical, I would say, because basically we don't have much time. I would say 9 to 12 is 9 to 9 p.m. is actually 12 hours of working to get the work done for the testing. So it's very critical, because we need to do all these changes, and facility and technical management team we need to put in place during that time. They need to understand what is happening during that time. They need to be aware that there is a changes, there was an increase in terms of electrical usage and people need to understand that there is some minor in terms of the facility improvement as well. So all the facility team need to be there during that time. Okay, So, and then um, um, obviously operation of the operation of the testing, operation um, of the personnel during that time obviously change. Okay, so basically we identified like which lab will conducting which activities, and each test, each process, there is a changes in terms of numbers of samples, in terms of numbers of personnel involved, and all personnel need to be trained. And during that time, we know that during COVID-19, we did like bubble grouping of the personnel because we want to avoid any exposure, or and we want to avoid like all the person who involved in the testing need to be quarantined. So we need to have that kind of practice. So basically we have we implement like bubble group, where this group of people is only working at this period of time, or schedule them, because we want to avoid any exposure between other group, so that the lab can still be functioning if any positive cases among the staff. So it's much easier for us to manage all the schedule for the staff itself. So, and then changes in procedure and practices eventually happen because from manual we start dealing with doing or using automation. So especially, I know almost every labs, almost every facility involved during that time start to get all these automation for extraction of the virus itself. So there is a changes which maybe the staff was not very like competent to handle it. So during the period of 1 to 2 weeks, we need to train them. We need to ensure that they know in terms of, and we need to also emphasize on the safety and biosafety parts that need them to aware with when handling all this automation. We are not saying that automation is less like exposure, but we need to understand how to mitigate each and every single steps of the procedure to ensure that there is no potential of spill, there is no potential of exposure during the procedures. So, and then obviously administrators overload, or the samples need to be like or the registration procedure is very hard, I would say. During that time, the new system was introduced during that time, and it's very hard for us actually. And then what we did was we identified the needs and extent of the work process, procedure, workplace health risk assessment, and occupational related. And then personnel and leadership as well is very important during that time, I would say, because when we have group of staff, when we have people who are not trained and well trained, there are a lot of things we need to manage in terms of the personnel, the lab personnel itself. And then continued review of the operation and the adequacy of the personnel and facilities. Okay, and then should be communicate, train, and document. As I mentioned just now, everything needs to be trained, communicate every time, every single time, for them to aware that there is the changes, what need to be improved, and everything need to be documented. Okay, and then next is I always emphasize on human resource. Okay, because basically, as we know that based on the incident reporting, human resource factor is the most highest causes or root cause that cause the incident. I'm not saying that personnel, lab personnel is the factors, but improvement in terms of that need to be done, especially in terms of personnel training, awareness, and competency when conducting any activities, I would say, especially in related to biosafety matters. Okay, so what we did then, as I mentioned, during 1 to 2 weeks, we need to train our personnel. we have like more than 10 people during that time, which is considered involved, but we need to increase the numbers after that. So we need to train another group of people, and they need to be competent. They need to be aware of the safety and biosafety practices. So it's not easy because we don't even have trainers in place. And then all the when we talk about all the practices, they need to be test in terms of fit testing requirement, because they are using N95, and a lot of things need to be done, and to ensure that the lab personnel is safe during handling or doing testing of this SARS-CoV-2. That is the important part for me, because we want to ensure that all the activities involved or improve or any changes will not jeopardize the safety of the personnel who involved in this. Because eventually, if one positive cases in terms in among the lab staff, basically a group of staff need to be quarantined. So it's very hard. We can't afford to have one staff quarantine or group of staff quarantine for 14 days. Eventually, it's going to be overwhelmed for the other group to be like, and then we need to increase the capacity as well. So basically, what we did was during the, lunch hour or the cycle of the group of the staff. So basically, we have one group. We have scheduled one group of people in different days, working days. So basically, they are not meeting each other, because a group of people will be working in one day, and another group will be working the next day. So basically, they are not meeting each other, and then we want to avoid the exposure. So what we did was during the so-called rest day, so all the personnel will be trained, and the other group will be doing all the testing. So there was a day where they can be trained, and we can review their competency and skill in terms of the safety and biosafety as well, and then to assess the ability to ensure that the personnel are able to perform their work competently. That is the most important part, because eventually when we talk about all these lab personnel and then doing all this testing, the most important part is the safety, and the quality of the result itself is very, very important. We are not going to have someone that doing all the doing the testing, however, they are not competent, and eventually we don't get the good or correct results. That is very important as well. Okay, so what how we manage, we expand the pool, and then mentoring and supervision are highly recommended when changing procedure, when changing personnel as well. So during that time, I was the only person there, so-called as the safety and biosafety officer, and manage all the flow process for the whole 1 month during the changes as well. So what I did was, every single time where I'm not involved with my part of procedures, so I will be sorry. So I will be with the personnel to review, to assess what they did, and to always remind them in terms of whether they are doing it properly, whether they have been changing their PPE, whether they have been, and also you need to remind them to eat and get their self equipped with, drinking and eating. They need to have their own, it's not like 24 hours of working or 12 hours of working. They have to be rest. So the changes, the schedule normally need to be reminded, so that they're aware that there are times for them to be rest, or they have to eat, their cycle, the schedule, because sometimes they didn't aware of all this, because there was a lot of samples, and they need to manage per day. So, and then behavioral factors again, and management of focus during that time. As we know, when we talk about pandemic COVID-19, we know that everyone was overwhelmed. healthcare workers, they don't even, I mean, like, have time for themselves. It's very hard. Some of them are very stressed. It's not only the healthcare workers, I will say, it's our lab personnel also have this kind of stressful, I mean, of condition and situation as well. So I would say that they need to work like 12 hours. There are some communication lacking. There are some I mean, like something which is cannot be agreed among the staff itself, and then a lot of things happen when they are previously not in the same team, and we need to team them up and understand each other within a short period of time. So it's very challenging, and they need to learn very fast. And obviously, people are not agreeing with everything. So sometimes there are some misunderstanding as well. So to ease them, to make them understand is very challenging, especially for me myself, because I need to coordinate them. So a lot of stressful, a lot of things. They have family members as well for them to manage. So pandemic COVID-19 is very challenging and a very good experience for us to handle. And then it's a good experience for us to understand what was happening during that time. So what we did was, again, consultation, communicate with them always, and everything, any instruction, any changes need to be clearly, concise, and timely communicate to all the lab personnel. Avoid misunderstanding, avoid miscommunication, because eventually that can cause, them not focusing on what they are dealing with. Okay, and then proactive communication and consultation process, maintain motivation and engagement by explaining and frequent reminders the critical role of lab testing as well as safety. That is very important. Sometimes because they want to, they know they have a lot of numbers of samples. Their thinking is more on to keep their work very fast. They need to complete the task. They don't want to go back very late at night. So they need to understand that the quality and safety need to be put in place so that they don't it won't affect them as well. We don't want to speed up the process, but you did not implement all these safety and quality processes and support of on the individual's needs. We are human beings. We have a lot of things need to be managed, and we need to understand that they also have their own challenges in terms of their personal life. So that is quite challenging during that time. So, and then occupational health program. Previously, we don't have a very stringent occupational health program, but we know that during COVID-19, our focus is not to get anyone infected, positive, so that we want to avoid any reduction in terms of our personnel capacity. So basically what we did was we always surveillance during the working periods, and then reasonably practicable to prevent the mental health effect due to the workplace exposure. Okay, and that is not only related to COVID-19, because basically they are dealing with samples and they can even expose to any other infectious disease or infection. And then, so what we did was daily health screen for symptoms. So they need to report to the offices, and then early referral to occupational health if there is any potential of exposure. So basically we send them to occupational doctor for further advice, for further mitigation for the personnel itself, and then consultation training from expert to avoid reduced distress and mental illness. Okay, so again, our lab personnel is human being. So they have all this condition, and there is a potential for them to have mental illness during the, like high loads of high workload during the pandemic. So it's very important during that time. So we emphasize a lot, especially we want to protect our lab personnel to have this kind of problem or situation during the pandemic, COVID-19. Okay, and then this is a worldwide challenges. Okay, we know that everyone, every single person, and eventually I'm impressed that basically we as the lab personnel eventually became the producer of the PPE. So we know that during that time we have all this shortage, and eventually I'm impressed that everyone can develop or produce their own DIY PPE, so-called, right? So basically we have units in our hospital that produce all this face shield by our own, and then we also need to discuss on the shortage of N95 during that time. I would say the gown, and eventually even our known designer of Malaysia or worldwide itself producing gowns for lab personnel. That's impressed me. Actually, we have like maybe if I'm not mistaken, there's one known worldwide designers that produce the gown. I'm impressed that we the lab personnel able to wear something which is very high end, so-called, in our lab. And then that is very interesting actually. So lesson learned from there. Actually, why we want to understand that in Malaysia itself, do we have company or producer that can produce all the PPE? Because we can't even liaise or waiting for outside to send it to us. During that time, to get one box of item, it costs you about more than 3 months, right? Because worldwide shortage, they can't even send it to us. They need to send with, like considered high risk country, and those can pay directly, and those that have the custom release easily. So it's a lot of things to be. And then basically all the PPEs, not only us using during that time, but eventually all the community, they need all the face masks, they need all the, even people wearing gloves outside of the lab, and it's a very interesting. So basically I would say worldwide, anywhere is a lab, because everyone wearing glove outside. In the mall itself, they are wearing gloves. I'm totally like, if they are wearing, I'm like, that is very, very, like the people who are in the lab will be thinking like, why are you wearing a glove outside of the labs? So it's very distress for me, if you ask me. And then during that time, we need to manage our inventory, administrative management of the purchasing. We need a dedicated personnel to oversee all this inventory purchasing of the PPE, and how to get, where to get, whether we have the resources to get all these. And we also receive donation from a very kind people outside of the hospitals, and reassessment and mitigation in terms of, if we truly don't have them, what we can mitigate, what are the mitigation that can be put in place so that our personnel are not exposed to, during the lab work. So, and then from there, we noticed that improvement and sustainability in terms of work processes, lab work practices should be put in place and understand. Okay, so what we did was continuous monitoring on performance internally. We are not expecting someone outside from our labs to come and monitor or giving all this evaluation in terms of our performance. So we need to have that in our own lab setting, that performance evaluation continuously being evaluated. So that need to be in place. So continuity in terms of systematic approach, and adequate backup and contingency measures need to be planned and put in place. It's not something that we, whenever it happened, then during on the time or on the needs itself, then you come up with all this. So basically everything need to be planned, preparedness of all this shortage or of the lacking need to be identified and documented. And the most important thing is the institutional supports. They need to have all these adequate funding resources, not only for the funding, but as well as the human resource. And then people in the lab personnel need to be adequately, continuously trained, not only related to their lab practices or work procedures only, but in terms of safety and biosafety. They need to understand all this. It's not something that when there are pandemic, then we train them again. Continuously need to be trained. And then continuous assessment to ensure the needs. So we need to understand what is the need in terms of the safety and biosafety requirement, because eventually during the pandemic, SARS-CoV-2 is not considered something which is low risk organism or infectious agent that we handle. Basically, those people who handle should be well trained in terms of biosafety, if you ask me, because this is not something which is very low risk. So basically, all the personnel who handle the organism, who doing all the lab activities should be well trained, so that they understand how to handle so-called moderate or to high risk organism. Okay, so basically this need to be put in place beforehand, not during the pandemic or coming pandemic and so on. Okay, so interagencies efforts. So during that time, because of the lacking itself, we had supports and engagement, networking with all the interagency in terms of funding, in terms of support with all these resources, with all the advice from them as well, and in terms of the equipment, we have a lot of support from our interagencies communication and networking. And then again, as I mentioned, lab networking is also sharing with the internal and external of our labs. So basically, it's not something that we communicate internally, but it's something that we can get advice and communicate from our external groups, because eventually maybe they have their own come up with their own or their own practices that can be much better or much faster. Should be something that we can refer to and get advice to. So it's not only our internal people who are actually good, basically. So we have people outside that can give us advice actually. And then continuous support from external agency actually is a very critical during that time, during pandemic, because we are lacking of everything. And international networking among the biosafety expert. When I talk about biosafety, basically we get a lot of support from our experts from worldwide actually. So this IFBA, International Federation Biosafety Association, is an association that have all the expertise, and they have been communicating with us, they have been informing us, supporting us, guiding us in terms of biosafety improvement. And I would say WHO has done a lot of things, and is very and they have come up with a lot of guidance in terms of biosafety that assists us a lot actually. And then continuous support from external agencies significantly supplement the emergency need. Okay, again, as I mentioned, emergency need is something that we can't predict. We can't probably to be planned. However, we can't even predict whenever it happens. So basically, we need to have all the networking and engagement with our external. So basically, I would say this initiation of this association is a good networking for us to communicate anytime in the future to support each other, right? Okay, so with that, I just want to share with you all these references, and from our experience, we come up with this paper. You can search for this paper. Actually, we publish a paper providing a lab diagnostic services for pandemic SARS-CoV-2 in developing country, and then all the guidance document from Ministry of Health, from the WHO, and from the Biosafety Manual, and so on. And then with that, I think that's all from me for today. So a great safety culture is when people continue to work safely and do the right thing, even when no one is watching. Okay, with that, thank you.
Thank you very much, Puan Lela. It was a very informative lecture, and I believe it is a down memory lane experience for many of us who were affected during the pandemic, and how we struggled to keep the things running. Yeah, and now we would like to open the floor for questions. If anybody have any questions on biosafety and biosecurity, please feel free to unmute and request more information from our speaker. Yes. Or you can post it in the chat box, so I will be able to ask on your behalf. Okay. Is there any questions? We'll just allow 1 minute for participants to prepare or get ready of questions. I see some comments that saying by Mr. Muhammad Nasrul, still remember those days. So 1 sample is equal to processing 50 samples, and what a disastrous moment. I'm sure many of us would agree. It was truly a disastrous moment, and none of us were prepared for such a emergency in such a short period of time.
Yeah, obviously.
Shaken everybody's
And then
exactly.
And I'm impressed, and I would like to congratulate our lab personnel, everyone who involved on all this. Basically, we actually managed to show that we are very capable, because during the short period of time, we managed to handle all samples, which from 100 initially, it became like 1,000 per day. So basically, it's very hard, very, very hard. Because basically, in our setting during that time, we actually received only 100 something in our hostel, but eventually, because we need to support our groups. So basically, they have all this networking, and they inform us if there is a labs we cannot manage the samples, they can send it to us. So towards the end, before I end my time in my work in the diagnostic lab, so we managed to handle 700 per day with the automation, and and small numbers of group, I would say, small numbers of people, less than 10 people per day running for 700. Not including all the, the group to process the samples is very, very hard, obviously. They take about half a day to handle the samples only, not involving all the PCR and so on. Yeah. So
you must congratulate all the staffs who are very hardworking and sacrifice. Yeah, there are so much of sacrifices all over the nation. Yeah, there are some questions in the chat box. Okay, from Inchik Zuhaimi. May I know what is the difference between biosafety and biosecurity?
Okay, so maybe I can answer this question first. So basically, biosafety is actually practices that protect personnel or unintentional release of the organism. So basically, for examples, when we do all the lab work practices, we need to implement biosafety to avoid us to be exposed unintentionally. However, when we talk about biosecurity, it's more towards understanding that there is a theft, potential misuse, or people from outside or internally that needs that particular agent for them to misuse for intentional intentional basically we want to avoid intentional release of our organism inside our lab to the outside world where we don't know what all these people potentially use that can cause harm to people. So as I mentioned, if you have like 100 microliter of virus, basically you can multiply and can cause outbreak. So that can happen. Actually, there are few of cases happen even in Malaysia itself. There's a potential, and nowadays they have all this DIY lab, so they can manipulate in your in the house, at your home. You can do all this. To buy all this machine is very easy. We have all this DIY online buying. I have experience. I was looking at online where that you can get all the machine, simple machine that you can multiply actually less than 100 or less than 300 actually. Yeah. So
Is there any regulation to actually control all this in Malaysia? Like, because there's a
I'm
lot
not
of
saying
DIYs.
okay.
Yes.
There is if we are talking about GMO or LMO related activities, basically we have this Biosafety Act. They have been there since 2007. However, when we are talking about infectious agent, at the moment we are relying at the PDCA, Prevention Disease Control Act, but then we have the policy in place under Ministry of Health, and we have been part of developing all this policy. We are improving when we are going to revise all the policy in terms. I will because our intention is not to like regulate at the starting point. We want every single facility to be prepared, to be aware, to be trained before we can regulate. Because when we talking about act and regulation, so basically if you are not compliant, you will be penalized. So we don't want that. That is not a good culture. I mean, like, we want you to understand how to do it. So as I mentioned, so it's not something that everyone need to say that, okay, you need to do this, you need to do this is for you to comply. No, that is not the good culture. You need to understand why you need to do it. You need to do it by your own. It needs to be a culture. It's not something that people need to monitor, or CCTV not need to be there for them to monitor that you are doing it properly. Because eventually, if we have people that know how to override all this, they will do it on how stringent you regulate them, actually. So we want to emphasize that.
Okay, there's one more question from Encik Zuhaimi.
Yep.
Based on your experience, how is the biosecurity implementation in other countries?
In other countries, they have countries that are very stringent. I would say like Canada, US, Australia. They have every act in place. Okay, our neighbor country, Singapore. They have this pathogen. Sorry, Bata Act. I don't remember. Biological and Toxin Act. That is very stringent in Singapore. If you want to have a biosafety officer, you need to be trained for 1 week. You need to get the cert in place, and then you can be appointed as a biosafety officer. I've been there. There was an exam. Luckily, I passed it, and then it's very stringent, and you need to pass the exam for the BATA as well, for you to become the appointed biosafety officer. And every facility that have or handle infectious agent, so-called agent, or biological material, they need to have a biosafety officer in place. So basically, I would say Singapore is one of our reference implementation in terms of biosafety as well as biosecurity. When we talk about biosecurity, the most stringent, I would say, in the US, they have all these select agent. Okay, so basically, if let's say you are the lab, we know that in the US, they have been handling or doing research of all these high risk agent. So basically, if you want to conduct listed, considered high risk agent, you need to be like registered, first of all, being monitored by the agencies, truly registered. If you are not compliant, as simple as you did not report one incident, your lab will be shut down. Okay? All the personnel need to be trained. I would say they are more stringent than our radiation regulation here in Malaysia. They are select agent is very stringent. It's very hard for them. But talking to those people who have been involved in select agent practices, they are very like crazily trained in biosafety and biosecurity. They are very well trained. In the US, if you are when we are talking about Canada, US, UK, they have been a very good association or implementation in terms of biosafety and biosecurity. Their experts is, I mean, well experts, very competent. I mean, they understand everything. And I'm impressed that when we talk about the facility itself, they have totally a dedicated person in terms of facility. They have engineer that know biosafety. They have architect that know about biosafety and biosecurity. Totally impressed. I mean, like when I did a training in the US. So basically, I learned from architect that trained us in terms of biosafety and biosecurity related to facilities. So I mean, like, why you need to have architect or engineer to be this good, right? So and then I had a workshop when they talk about operation people, technical people who need to be trained and to understand about especially facility biosecurity. Because eventually when we talk about biosecurity, we talk about a lot of physicals, I would say, but our engineer, our facility, our contractor did not understand how to do all this. Yeah.
Yes.
Exactly.
Thank you for the in-depth answer. And we have one more question from Ms. Putri. Which one is more important, biosafety or biosecurity when we work in the laboratory? I mean, which one should we do first? Because we are not very sure where to start. So
Okay,
she's asking for direction.
So basically, biosafety and biosecurity actually complement each other. You need to have both. But in terms of when you are talking about your personnel, to ensure that they are not exposed or infected with the agent that they are dealing with, biosafety was actually biosafety and biosecurity actually is there. It's just to improve, and you need to understand how to what is the best practice in terms of biosafety, biosecurity. So basically, what we need to do is that we need to look at what is the biosafety, bio risk management component. We need to outline what in place, what need to be improved, what needs to be developed or established, and everything need to be worked out from the framework, I would say. Come up with the system, evaluate, monitor, and then you need to discuss further with the management. Support from the management is the first thing that you need to put in place. So basically, there are guidance. What is the requirement? So if you ask me in terms of lab, look at your biosafety first. Biosecurity is there, but you need to, is either you need to strengthen, you need to actually define the biosecurity. Basically, when you have lock on doors, it's actually our biosecurity components in terms of physical, but then we did not call it as a biosecurity, but basically we just say that lock. Our lab door has a lock. Basically, the requirement for you, why you need to have a lock, that is the understanding in terms of biosecurity. I would say you can start your first step in terms of biosafety and look at what are there in terms of biosecurity, because biosecurity itself, it depends on the risk. Because basically, if you are only handling, I mean, like low risk agents, so basically it's not that stringent. So I think what existing need maybe should be sufficient, but again, you need to relook. Biosafety in related because you are, I mean, actually have lab personnel who are dealing or handling every day. So you want to avoid any exposure to them, okay, to their family members as well, secondary to our environment, community, and so on. So basically, both actually are important and complement each other and need to be put in place. That is what we call as bio-risk program.
Thank you very much, Puan Lela, for the very comprehensive answer. I hope that answered the question just now. And one more last question. Do you think that now we shall have a biosecurity officer in the lab? As we know, the implementation of biosecurity is not so in place. So this is by Chief Zuhairi.
So basically, if we are talking about biosafety or biosecurity officer or biorisk officer, there are lots of names. In terms of that. So basically, for the Biosafety Act, there are requirements for a biosafety officer to be in place. So all institutions that handling or having an activities related to GMO and MO is a requirement for you to have a biosafety officer registered to their regulation. However, in terms of infectious agent, as you can see, and you need to look at that, because basically in terms of the policy, there must be a person who manage the institutional biosecurity. So basically in that sense, it's actually described that you need to have a officer in place. So coming soon, the policy in biosecurity is going to be address the needs of a so-called biosafety or biorisk or biosecurity officer in the institutional that handle all this. So basically, there are things in place going to be approved hopefully soon, very, very soon. And if you ask me, yes, you need biosafety officer or biosecurity officer in the lab, because eventually it's not only the implementation, but you need to have people that understand, that can advise, that can plan, that can oversee, monitor, and evaluate all this. Okay, at the moment we don't have people external people that can come and review your things, and we are not we have standard in place, but eventually the standard has not been translated into nation standard. We are in the process to convince the department standards to translate this biorisk management standard ISO 35001 to be part of our implementation, so that once you have been certified in ISO 35001, sorry. So basically you are so-called competent and certified in biorisk management. So basically everything should be in place, especially all the training for the personnel itself. Yeah.
Okay. I think we have more questions. We'll just try to continue because I think Okay. In order to get ISO 15189 accreditation, do biosafety officer is a part of the requirement for the personnel?
So actually, I'm not part of ISO 15189, and I knew that there is a revised version in terms of that. I'm going to read that. I just known last few weeks when we was in the conference. So basically, I was informed by a colleague of mine. In 15189, there is a requirement for an officer to oversee all these activities, especially when you are in the microbiology lab. It's not clearly stated that you need to have a biosafety officer in the standard itself, but eventually the clause described as such. So basically, yeah, there is a requirement for 15189 under 15189 accreditation that a so-called biosafety officer to be in place, especially in microbiology lab. And eventually, a friend of mine in UMMC, she is the biosafety officer for the UMMC itself, and she had been appointed for that purpose, so that they can comply with the requirement for 15189. So basically, I'm not really aware. Maybe I can give you all the information later. I need to discuss further because again, I'm not part of the ISO 15189. Yeah.
Just one more question. Do you provide any training frequently for the lab personnel to be compliant to the biosafety and biosecurity?
Yes, we do. We do have that under the Malaysian Biosecurity Association. We have For your information, we have started. I'm part of the team that start all this since 2013. I was trained starting from 2010. And actually, I involved with the development of the facility. So starting from 2013, actually, Malaysian Biosafety Biosecurity has trained, we call it Malaysia Advanced Biosafety Officer Training for Malaysia. Since 2013, we have conducted 4 series, and then we have trained around 110 people under this ABBOT training. Basically, they need to go through 6 weeks of training, very comprehensive. Basically, everyone that have been gone through the training, certified under the training, because they need to go through all these assessments, so-called, can be considered as competent personnel in terms of biosafety, biosecurity. So basically, we have 110 people that have been trained. Yearly basis, you can contact us to get for your own institutional, so that we can support you in terms of our trainers, as well as the module setting. And then and eventually we also have developed or have quite a numbers of training internationally and national training for all this. And I'm also involved in the Ministry of Health related to the establishment of the training for biosafety, biosecurity. Hopefully, they will come up with the document, guidance document, as well as hopefully instruction wise for all of the personnel in Ministry of Health to be trained in terms of this. And under the other agencies, we are come up with all this training module as well. So hopefully I can share all this once it's finalized. Yeah. But in terms of association, yes, we do have. In terms of the university, I have conducted this since I've been appointed as the biosafety officer. Yeah.
Thank you very much. And one last question, I hope. Can someone with certified safety officer from NIOSH become biosecurity officer?
Basically, it's a different thing. I would say I've gone through all this safety health officer training, 22 days at NIOSH. Basically, the component of biosafety in this training is not sufficient enough at the moment. So I would suggest that if you want to become a biosafety or biosecurity officer, it should become from our side, or actually there are various agencies. And then I would say for actually MBBA will be established or finalize our so-called, we want to establish a so-called registered biosafety professional training. So once you have done completed the training and certified for the competency, so basically you are going to be so-called we want to have similar training with Singapore, so that is trained and competent in terms of biosafety and biosecurity. But unfortunately, those under NIOSH is not sufficient enough at the moment. They are not really like there is no like so-called engagement with NIOSH, so that we can have this like being trained under safety officer. So basically you can also become the biosecurity officer. So at the moment there is no finalized in terms of that. Yeah. And then Tia, maybe we met. I have few friends in Indonesia. Hi, nice to meet you. Actually, it was same situation in Indonesia. And thank you for attending this webinar.
Yes, thank you very much for international participants, especially from Indonesia. We are glad that you are able to make it. And also for our local participants, it is so we are so glad to have you in our webinar series. We are looking for active participation from all of you in our future webinars. And I would like to thank Puan Lela for her wonderful and awesome lecture today. It was so informative, and we are so privileged to have you in our session as our first webinar speaker. Thank you very
Thank
much.
you so much. Thank you so much for,
Thank you so
for
much.
the invitation, and thank you so much for the opportunity to share this. I hope that I have share with you the best part that I can deliver. So if you have anything, I think I'm so sorry I did not stated my email address here, but maybe I can share here.
Maybe
If anything, you
post it on
can.
the chat box.
Yeah,
Yes.
I write down at my on the chat edu.my. I can try my best to support everyone. I have team that have been trained. I can introduce you to all of them. Oh, contact number. Okay, sure.
Thank you very much, everyone. If you have any questions, you can feel free to contact Mrs. Faizatul.
Yeah,
You
thank
can
you
send
so
her email. Yes. Okay, with that, I'll pass back the webinar to the host. Yeah. Thank you very much for inviting us to moderate and also to conduct this webinar series for today. Thank you.